Earlier this week, the State Department of Health issued a warning about a measles outbreak after an uptick in cases this summer.
And with some kids already back in the classroom, many parents are worried. So joining us now to help us get the facts is Dr. Esther Liu, the Chair of Pediatrics at the University of Maryland's Baltimore Washington Medical Center. Thanks so much for joining us.
Hi, thank you for having me.
Let's start with the numbers here. 27 measles cases have been confirmed since July 15th. How concerned should parents be about this? School is starting now.
Yeah, so measles is one of the most contagious illnesses that we know of. So especially for our children who are immunocompromised or not vaccinated, it is a huge concern, especially because we do know that children are one of the highest risk groups for complications from measles.
All right, and you mentioned measles being one of the most contagious viruses. What makes it so easy to spread, and then how long can it stay on surfaces?
So measles is what we consider an airborne virus, and so the reason we get so concerned about the spread of measles is that people can be contagious with measles for up to 4 days before they even have symptoms. So they can be contagious before they even feel or look sick. Additionally, because measles is considered to be an airborne virus, the virus can spread even after the person has left the room for up to 2 hours.
So you don't have to worry about surfaces, is what you're saying, since it is airborne.
Yeah, so in general, we always want to be careful with touching things and putting especially with children, putting their hands or toys or other objects in their mouth. But really the concern is breathing it in.
Okay. You talked a little bit about the leeway between being infected, I guess, and symptoms. What are the first symptoms that parents should look out for?
Yeah, so really with measles, we really think of like a really high fever. And then from a training perspective, when we are training medical students and residents, we tell them to look for the 3 C's, which is cough, coryza, which is a very profuse runny nose, and conjunctivitis, which is like a pink eye. Those are the 3 C's of measles that all start even before that classic rash that people think of. So a lot of times parents can think, oh, this is just flu or a virus. They just have a really bad cold. And so again, this is why it makes it so difficult to contain before it spreads so quickly.
All right, and what about the MMR vaccine? If people have gotten that in their home or their kids have gotten it, I mean, should they still be concerned?
So the MMR vaccine is definitely considered to be very helpful in terms of protection. So in terms of after the first dose of vaccination, we consider up to 92-93% of the population will be protected from measles. And then after that second dose, that number goes up to 97-98% protection. So if you are fully vaccinated, you are likely to be very protected in terms of risk of infection. Unfortunately, some people, because of their immune status or certain medical conditions, may not be able to build that protection even after vaccination, or because of certain medical treatments such as cancer treatment or immunotherapy, even if they've been vaccinated, they lose that protection.
All right. Some really great, important information right now. Dr. Esther Liu, thank you so much for being with us.
Thank you for having me.
And you can go into greater detail from symptoms to vaccine information right now in the WBAL-TV 11 News app.